Hi, this is Joycey. I am in group number 3. In our group, we have Chris Jankowski and Tasha Parker and me, Joycey Pranabdev. Our topic is antagonist. What does the antagonist do and why it is important? Antagonist is a substance that acts opposite and blocks an action. The antagonist does the opposite of an agonist. The antagonist binds to receptors and stops the receptor from producing the expected response. Agonists and antagonists have a central role in human physiology and pharmacology. The antagonist has the primary role in reversing the action that has already happened or blocking an agonist action. The explanation for the antagonist is an easier way to understand. The agonist is a good guy trying to do something good, and the antagonist is the bad guy trying to stop the good act. Some antagonists block the receptor, then is called beta blockers, and also there are alpha blocker and calcium channel blockers. The antagonist affects several functions including skeletal muscle movement, hormones, organ functions, and to treat diseases. There are several kinds of antagonists. It can be divided according to its biological response or by the mechanism of action, including chemical antagonists, physiological antagonists, pharmacological antagonists, competitive antagonists, allosteric antagonists, and physical antagonists. Insulin and glucagon are physiological antagonists of one another. Both binds to two different receptors and both produce effects opposite each other. Insulin decreases the blood sugar level when glucagon increases it. Antagonists have an essential role in central nervous system and also in the autonomic central nervous system. Among central nervous system, the main antagonists are dopamine antagonists and serotonin antagonists. Dopamine antagonists and serotonin antagonists have wide use in treating a variety of psychotic and medical symptoms. Mainly serotonin antagonist drugs used to treat conditions like schizophrenia, mania, bipolar disorder, etc. Important autonomic nervous system antagonists are muscarinic antagonists, nicotinic antagonists, alpha blockers, and beta blockers. Beta receptor antagonist drugs are used to treat angina, myocardial infarction, cardiac failure, and asthma. Muscarinic antagonists help increase the airflow within asthma by blocking cholinergic tone, inhibiting secretion, and help to clear mucus. Also, muscarinic receptors have a role in managing acetylcholinesterase inhibitors overdose, dilation of the pupil, motion sickness, overactive bladder, antispasmodic and antidiarrheal treatment, etc. Antagonists also have an essential role in muscle function. They maintain body or limb position. Antagonist muscles are responsible for the bones returning to their original position. Overall, antagonists have a wide variety of functions throughout the body system. Thank you.
Hello, classmates. It's me, Tasha. Hope you guys are well. I am a part of the group that was responsible for the video on Antagonist, and I have the list of drugs that are antagonists. There were quite a few from Stahl's Prescriber's Guide, and I will go through the list, but I will also provide a typed up document that includes the generic and brand name of the drugs, just so maybe if I mispronounce something, you'll have that resource. The first drug is a camprosate. It's a weak NMDA antagonist. And then there's agomelatine. It's a 5-HT2C antagonist. Emilsapride It's a dopamine receptor antagonist. Amoxapine, it's a serotonin 2A antagonist. Acenapine, which is a dopamine, serotonin, norepinephrine receptor antagonist. Blanacerin is a serotonin dopamine antagonist. Carbamazepine is a voltage sensitive sodium channel antagonist. Chlorpromazine is a dopamine serotonin receptor antagonist and a dopamine 2 antagonist. Clozapine is a dopamine, serotonin, and norepinephrine receptor antagonist. Cyamazine is a dopamine 2 antagonist and a serotonin dopamine antagonist. Dextromethorphan, which I found interesting because that's in cough medicine. That's just an aside. It's a non-competitive N-methyl D-aspartate, which is NMDA receptor antagonist. Esketamine is an NMDA receptor antagonist. Flibanserin is a serotonin 2A antagonist. Flumazenil is a benzodiazepine receptor antagonist. Flufenthioxazole is a dopamine receptor antagonist and a dopamine 2 antagonist. Flufenazine is a dopamine 2 antagonist. Haloperidol is a dopamine receptor antagonist and a dopamine 2 antagonist. Hydroxyzine is a histamine receptor antagonist. Iloperidone is a dopamine and serotonin receptor antagonist. Ketamine is an NMDA receptor antagonist. Lamotrigine is a voltage sensitive sodium channel antagonist. I think that extra credit should happen because of some of these words. But moving on. Limbexiran is a dual orexin receptor antagonist. Loxapine is a dopamine and serotonin receptor antagonist and a dopamine 2 antagonist. Lumateperone, serotonin dopamine antagonist. Lurasidone is a dopamine serotonin receptor antagonist. Memantine is an NMDA receptor antagonist and a glutamate receptor antagonist. Mirtazapine is a serotonin norepinephrine receptor antagonist and an alpha 2 antagonist. Molindone, I apologize, dopamine 2 antagonist. Nalmefene is an opioid receptor antagonist. Mu and delta opioid receptor antagonist. Naltrexone is an opioid receptor antagonist and a mu opioid receptor antagonist. Nafazodone is a serotonin receptor antagonist and a serotonin 2 antagonist. Olanzapine is a dopamine and serotonin receptor antagonist. Oxcarbazepine is a voltage-sensitive sodium channel antagonist. Paliperidone is a dopamine serotonin receptor antagonist. And perospirone is a serotonin dopamine antagonist. Perfenazine is a dopamine receptor antagonist and a dopamine 2 antagonist. Pimozide is a dopamine receptor antagonist and a dopamine 2 antagonist. Pipothiazine is a dopamine receptor antagonist and a dopamine 2 antagonist. Pitolisant is a histamine 3 antagonist and an inverse agonist. Quetiapine is an atypical antipsychotic that has serotonin and dopamine antagonist. Risperidone is a dopamine, serotonin, norepinephrine receptor antagonist. Sertindol is a serotonin dopamine antagonist. Solapride is a dopamine receptor antagonist and a dopamine 2 antagonist. Suvorexant is a dual orexin receptor antagonist. Thioridazine is a dopamine and serotonin receptor antagonist and a dopamine 2 antagonist. Thiothixine is a dopamine 2 antagonist. Trazodone is a serotonin receptor antagonist and a serotonin 2 antagonist. Trifluoroperazine is a dopamine receptor antagonist and a dopamine 2 antagonist. Trimipramine is a dopamine and serotonin receptor antagonist. Ziprasidone is a dopamine and serotonin receptor antagonist. Zodipine is a dopamine and serotonin receptor antagonist. And the last drug on the list is zuclopentixol, and it's a dopamine receptor antagonist and a dopamine 2 antagonist. So you survived listening to my entire list of antagonist drugs. I hope it is enlightening to you, and I will provide the printed list, the electronic list for your records. Have a good day.
Hi, my name is Chris Jankowski. I will be covering the antagonistic portion. And the questions I will be covering are questions 3 and 4. Question 3 states, any drug interactions that interfere with antagonists. When prescribing antagonistic medications, it is essential to know that drug interactions that may interfere with one another. For example, risperidone is metabolized through CYP2D6, and serum levels become elevated if the provider is prescribing strong CYP2D6 inhibitors such as fluoxetine and paroxetine. A serotonin antagonist medication such as clozapine must be monitored for drug interactions due to several possible mechanisms. First, the metabolism of clozapine occurs through CYP1A2 and CYP3A4. If a strong CYP1A2 inhibitor is used in combination, such as fluvoxamine and ciprofloxacin, the provider will need to decrease the original dose by 1/3. According to Gibson, when prescribing olanzapine, which is a serotonin antagonist, the provider should keep in mind that the medication is dependent on CYP1A2 for clearance. Olanzapine levels may be altered if paired with inhibitors or inducers of CYP3A4. Lorazepam, which is a dopamine antagonist, has a metabolism route through CYP3A4. Medications such as rifapentine and ketoconazole are contraindicated and can potentially change the serum levels. Avoid anticholinergic agents, loxodolone, glycopyrrolate, ipratropium, and levosulpiride when taking antagonistic medications such as olanzapine, clozapine, and risperidone. Researchers discovered that the anticholinergic effects have the potential to cause bradycardia, atrioventricular blocks, arterial hypotension, and neurological events such as confusion. Question number 4. Any helpful mnemonics to remember these medications? So there are a lot of antagonistic medications out in the market, ones that will directly affect the central nervous system or even the autonomic nervous system. The mnemonic that I came up with is, hey, some doctors never bet against old medications. Again, that is, hey, some doctors never bet against old medications. The H for hey is H1 and H2 receptor antagonist. And if you can follow with me on the form there, that way you can see the examples of these medications. The S for some are serotonin antagonists. Those examples are clozapine, risperidone, Abilify, ondansetron, anything like that. The D for doctors is dopamine antagonist. Those include haloperidol, chlorpromazine, and etc. The N for never is nicotine receptor antagonist. B is for the beta receptor antagonists. Those are the beta blockers, propranolol, atenolol. A is against, which is the alpha receptor antagonist, prazosin and tamsulosin. The old, or the O, is opioid antagonist, such as naloxone and naltrexone. And medicine are the muscarinic antagonists, such as atropine, ipratropium, and scopolamine. That is the end of the questions. Thank